This is ICAST News, live and direct from United Nations headquarters in New York, and this is A Healthier World. I'm Dr. Ben Milgram from New York University School of Medicine and Bellevue Hospital in New York, and I'm here with Dr. Sandushan Arula, who's the former United Nations Medical Director. We're here today to talk to you about Zika virus. So Zika is a big topic in the world today and in global health in general. Dr. Arula, tell us a little bit about the history of Zika and how it's come to be such a big topic in international news.
Well, I think there's nobody in the world who has not heard of Zika.
Mm-hmm.
It is being covered so extensively by the news media, whether it's the newspaper, whether it's the TV, wherever.
Yeah.
And also because of my own background, I have tried to stay. I've always wanted to keep myself informed if any of these outbreaks are going on anywhere in the world. And that's why this also has made me read everything that there was there, because this was the first time actually, it was last year or earlier this year, for the first time I was hearing the word Zika.
Yeah.
I think in my lifetime I've seen so many viruses, so many new outbreaks, but I'd never heard this word Zika.
Yeah.
And now, since February of this year, World Health Organization has even declared this as a public health emergency of international concern. I mean, it has gone that far. And this happened because of a cluster of babies born in Brazil with microcephaly, and somehow they thought there was some association with Zika virus.
Right.
And that's what everybody got interested, and they wanted to be sure that whether that was the cause and what can be done.
Right. So Zika is a virus that, although it seems like it's only recently become known in the international consciousness, it's actually a virus that's been around for some time. And it was originally discovered in the 50s in Africa, as you said, and then it sounds like it's never really taken off into big epidemics like we're seeing now. Just sort of little isolated cases, is that right? And then in recent...
Yes, I think that's what has been going on. As you know, I mean, for Zika infection to happen, for Zika virus to infect somebody, we need two things. One is that particular mosquito that can transmit Zika virus from one person to another, and second is virus. If both these things are together in any population, this transmission can happen.
Then people get disease.
Yes.
So it's a virus. So tell the viewers a bit what that means. So a virus it's not a bacteria. It's a segment of DNA that gets infected into another person and then causes disease. So in this case, that happens via various methods, primarily mosquitoes, is what you're saying.
Yes, the main, I think over 90%, even more than that. There's a vector. Vector in medical terminology is used. Some means or something which is carrying infection from one thing to another. Here the vector is a mosquito called Aedes mosquito, Aedes, and that mosquito is the same mosquito which has been spreading dengue fever and chikungunya, which I am quite familiar with, especially in Asia. But suddenly the same mosquito is now carrying Zika virus. And it's a new virus, so people don't have immunity to this virus. As you very rightly said, it's not a bacteria, it is a virus, so you don't treat it with antibiotics. Either you develop immunity after one infection or you need a vaccine. But unluckily, since it's a new virus, so far there has been no vaccine.
Right. So who should be concerned about Zika virus? Is it a serious illness? It doesn't really seem to be in most people.
You are absolutely right. In most people, so far as the illness is concerned, it is not serious. If you and I get it, what's going to happen? I mean, if we are bitten by an infected mosquito, virus will go into us. Some of us, maybe half of us will not even have, more than half of us will not even have symptoms.
Yeah.
And those who have symptoms are going to be just like any mild viral infection, like fever, joint pain, rashes, and conjunctivitis. Very non-specific. And these
things that can happen with like a cold or the flu or various other viruses.
Absolutely. And it lasts about 2 to 7 days, and you're okay.
Mm-hmm.
I mean, you may need some symptomatic treatment like Tylenol or just to make yourself comfortable. But the disease itself so far has not been reported in anybody that it was severe enough for a person to be hospitalized. So if you're looking at just the disease, it's a mild disease.
Yeah.
Yes.
So most people should not be too concerned about Zika virus. You know, it's something that can cause you to feel crummy for a few days, but
Yes.
generally it's just going to wear out and you'll
Yes.
go back to your normal life.
Yes.
It's just like you had the flu or something.
Yes.
But the people that it really matters for are, as you were saying before with the birth defects, that the people that this really is important for is people who are pregnant or planning on becoming pregnant,
Yes.
and their partners.
Yes, because that's what we call it as vulnerable population. I mean, it's the women who are planning to get pregnant or they're already pregnant. And during pregnancy, if they are bitten by mosquitoes and if get this virus, whether that virus is causing any symptoms in them or not, but it could be transmitted to fetus. And it has effect on growing brain of that fetus, causing birth defects. And the most common birth defect which has been reported is microcephaly. Micro is small, that means small head. That means the brain has not been developed.
Right.
And this is a very serious defect. Look at the child, the life of that child who's born, and look at with this anomaly, and the life of that family where the
Right.
child is born. So that is the vulnerable population.
Right.
And that's the reason this is getting so much attention, is because nobody thought this virus can have that much effect on a growing brain.
On a growing fetus. So that's really the issue. And then this microcephaly is a very, very serious condition. So the fetus might might miscarry. The baby may die very shortly after birth, or if it survives, will have very limited brain function.
Yes.
So it's a very serious condition.
It is, but if I don't know, when we were talking earlier today, I told you my first, I was a pediatrician years ago, and in my practice, I had hardly seen one or two, very few cases of microcephaly. And then having a big cluster of microcephaly in just one country, over 1,000 in Brazil,
Yeah.
it's unimaginable. And what that country and what those mothers and what those families are going through. So I think that's what has everybody got concerned,
Yeah.
and everybody's working on it. I'm working in the sense that how fast we can have a vaccine ready so that the population can be protected. And since it's a new virus, people have no immunity to it. And it will take time, but the way the things are going now, hopefully there will be at least some vaccine trials will go
Yeah.
at least towards the end of this year. But having worked with the UN for years, for us, whenever we used to hear about any new outbreak, any new disease coming up, we will always go to World Health Organization. We'll ask them, listen, will you confirm it for us? And then once they say yes, and then we'll say, okay, now give us the guidelines. How do we protect our population? Because UN has population worldwide. We have staff worldwide, we have traveling population, and wherever they go, it's a responsibility of United Nations to make sure they are protected. So we will look at them, give us the guidelines, how the staff or whoever is traveling in the field can protect themselves. And also World Health Organization also works with those countries, with their health system, to make sure what they can do to prevent such infections. So it becomes two-way. WHO will work with the World Health with the national health authorities, that how we can stop the transmission. Because if you look at the whole thing, it's very simple. If there are no mosquitoes,
No mosquitoes, no disease.
yes.
Yeah.
And mosquitoes carry so many other diseases. There's different types of mosquitoes, but prevention for mosquitoes should be the same.
Yeah.
One is you want to kill the mosquitoes. That's at the country level, and as a person traveling to those, you have to protect yourself from the bites. Whether it's with the sprays,
Yeah.
whether it's sleeping under mosquito nets, or whether screening your doors. So prevention is same, but you really have to be so aware of it and so well protected that if you are, especially if you are a vulnerable population, that you should try your best not to get it or avoid
Yeah.
going to those countries.
So the people that really should be avoiding these areas, and we should be clear where exactly the endemic areas now are. So the mosquito travels in tropical areas,
Yes.
and we have seen disease spread through mosquitoes basically from as far, only in the Western Hemisphere so far, and from as far south as Argentina up through Mexico,
Yes.
and throughout the Caribbean. But that entire geographic area seems to be affected now. So for people that are not in those areas but are thinking about traveling there, things that they should think about, So first of all, probably nobody should be going there unless they absolutely have to, that is thinking about a pregnancy. Is that correct?
Yes. If you are really, if you must, but I think you said very rightly, if you are planning to be pregnant
Or are pregnant?
are pregnant, you shouldn't go there.
Hmm.
I think every protection may not be 100%. You may still be bitten, especially in the countries where the transmission is going on.
Right.
Then I think that's a personal decision, and they should, as far as I know, they should not go.
Right. And then for people that are either living there or people that absolutely have to travel there, they need to take every precaution possible
Yes,
just to avoid a mosquito bite.
Absolutely. The other diseases transmitted by, like malaria. But for malaria, we had medicine that you can take to prevent. We call it chemoprophylaxis, but there's nothing like that.
But this is not one of those, that there's anything that can treat or prevent
your
it.
personal protection against mosquito bites is your best choice, and you make sure where you're living there are no standing water where the mosquitoes could breed. At least that much you can do where you're living, and the rest is the responsibility of the public health authorities of that particular country.
Sure. And I think it's important to discuss the sexual transmission of this virus. So it does seem that it's shown to have been transmitted sexually from males to females. It's unclear if the reverse is also true, but there is sexual transmission that we have seen. So that applies to people even without symptoms of the disease. So as you said before, the majority of people who get this virus will not even show any symptoms of it.
Yes.
But that person can still be a host for the virus. Either a mosquito bites him and spreads to somebody else, or that person can sexually transmit it to their partner.
Yes. I don't know how long it stays in the semen of a person who has been infected by Zika virus, whether he's symptomatic or asymptomatic. Initially they used to say 2 to 3 weeks, and now they're saying it may stay as long as 6 months. So they have reported in about 10 countries that this transmission has happened. Sexual transmission has happened. Recent cases in Germany, some infected person must have gone from another country and then infected somebody there.
Right.
So it is reported, though the majority will be by mosquitoes, but there are some. So the people have to be careful.
So that's about the only way that a person that doesn't live in an area where this mosquito goes, which is tropical areas. So if you're at a higher elevation, or if you're not in a tropical area,
and
you're not at risk to get this unless somebody who has it transmits it to you
by sex.
Sexually. That's about the only way.
Yeah, that's correct.
So people that aren't interacting, not necessarily, have basically no risk of this disease.
No.
Yeah.
And but sort of what has really, as you know, you must have read about it as I've read, there are about 39 countries, mostly in the in Latin America and Caribbean, 39 countries which never had experienced this virus in the past, and now they have been impacted. 39 countries, which is a very, very big number.
Yeah.
And there were some countries which had in the past, between 2007 and 2014, this transmission is not going on there now. My worry is, if you look at India, look at Africa, I have seen so many cases of dengue fever in India, and it's the same mosquito, but the Zika virus is not there. So if Zika virus reaches where this mass mosquito is already there, then you can imagine what's going to happen. And I think it's good that the whole world has been put to alert.
So now we're prepared,
Now we
hopefully.
are prepared, and one thing I think everybody must be trying to use it to find out is what's the way to diagnose this rapidly. Yes, that it has to be diagnosed. There has to be rapid testing so that it can be tested. And of course the vaccine, if I'm not wrong, this virus belongs to the same family as virus which causes yellow fever and Japanese encephalitis. It's the same family, and we have vaccines against those two. So I'm hoping that we maybe have virus against Zika soon.
Yeah, well, if all goes according to plan, hopefully that will happen in the coming years.
Yes,
It's already
yes,
under study.
Yes,
So hopefully a vaccine will come along.
yes.
But so it sounds like the bottom line is that this is a virus that people should generally not be too worried about. It's in
About
contrast.
their own illness, they should not
Yeah.
be that much worried about. Yes, you're right.
I think we're sort of still recovering from the hype around Ebola. And Ebola was a totally different animal.
Very
That was
serious.
that's a
Very serious.
virus with everybody.
Very serious, because transmission was through bodily fluid. Somebody,
And it's
whether
deadly.
urine, whether it was stool, whether it was blood, and it was deadly.
And it kills you. And
Yes,
this is not
yes.
that.
No. It's the effect on fetus's brain, which has which is really sad. And to tell you the truth, I had never seen so many cases of, as I said already, of microcephaly, and I've never even heard of Zika. But that is a real cause of concern. It's just that vulnerable population. And of course, the fathers of those, the husbands of those women, if they have traveled and they are bringing and coming back home, it can be transmitted sexually, because if they're coming back to the country where this mosquito is not there, that's the only way. And they have to be careful.
Yeah.
So safe sex has to be practiced.
Right. And it should especially be emphasized, those precautions, with the Olympics coming up in Brazil this summer, where there will be many people of the affected age being there. So all precautions need to be taken. So that should be another interesting event as this develops.
Yes, I'm pretty sure the people who are going from different countries, their own doctors or their own public health system, they have prepared them what to do, as UN does with their traveling population. That's how you are going to take care of yourself.
Yeah.
And I'm sure this message must have been conveyed.
Well, one can only imagine too, with with so many visitors coming in. You mentioned that the mosquito is present in in Africa, Asia. So we could really see this develop as so many people are coming in out of Brazil.
So many cases of dengue fever as we are seeing now in India every summer. So it's the same mosquito. You can imagine if you mix that mosquito with this virus, what's going to happen. So I'm glad the whole world is getting ready.
Yeah.
But still I feel really bad for the families who have
These affected babies.
children. And another medical condition which is being associated with it is called Guillain-Barré syndrome. I had seen several cases in India when I practiced there before I became international. I don't think they were associated with Zika, because there are so many other things they can be. But now they are finding that there is some association, because in the same country there's a rise of Guillain-Barré syndrome as well.
Yeah. And briefly, so this is a syndrome that affects the nervous system and basically leads to paralysis, which can be self-limited, and it can reverse itself.
In many cases it reverses itself. But till it is with you.
But it is a major illness that requires
a lot of disability at that time. But I've seen people getting out of it on their own.
So that's a very tiny minority of cases, and that's just been reported to be associated with Zika. It's nowhere near the level that the birth defects are.
Birth defect over 1,000
Yeah.
just in that area. Babies born with brain malformations.
Really quite stunning.
Very. I think many of them might have been infected during first trimester, because that's the time when the baby is really growing. That's the time of organogenesis. Organs are being formed, and that's the vulnerable period.
But that said, it's still recommended
Yes.
that affected
Yes.
males do not.
Because some effects can be there throughout the pregnancy.
Right. So it is
Worst is
recommended that all precautions in terms of condoms be used
throughout
the pregnancy.
That's absolutely right.
Yeah. Okay. Well, it's fascinating discussion, Dr. Narula. We look forward to this story developing, and hopefully this will end soon, and there won't be any more of these, poor babies and families with these affected babies. So we will see how this develops.
Yes. And doctor, I'm sure if there is a case in the city,
We'll probably see it
you
where
will
I
probably
work.
see in your hospital.
I'm sure that is true.
Yes.
Yes.
And we will talk again one day and we'll say, look, here we have. Because mosquitoes are going to be there in this city.
Yep.
Yes, because the season is changing. So the question is, if people are coming with this virus from other countries, there is a possibility. But if it happens, I think your hospital will be the first one to find a case. It's a pleasure speaking with you.
You too. Thank you very much. This was ICAST News, live and direct from the United Nations headquarters, and this was A Healthier, Healthier World.
Thank you.